So welcome both of you.
Yeah,
Thank
thank
you.
you. And I'll just make a note that Dr. Fuhrman has been a great inspiration for me and a source of knowledge to the extent that he wrote the foreword for the Sprout book by Dr. Joel Fuhrman. So just like it's a pleasure and an honor to be on the same platform with Dr. Fuhrman.
Yes.
Thank you, Doug. Same here.
My pleasure.
So why don't you, in your own words, just take a minute just to, for anyone who doesn't know you, to introduce yourself and tell us what you've been doing the last 5 years and get us up to speed. Doug, why don't you go first?
So 5 years ago, actually 7 years ago, I moved to the Mojave Desert to a little town called Wonder Valley. And it's the desert, but it was also a food desert, and I had no access to food. And so I had known about sprouting for 30 years, but I never took sprouts seriously. And here was my opportunity to have a great discussion with myself to say, hey, if I want to live here in this beautiful oasis where I had water and sun, how am I going to grow my own food? And the answer was sprouts. And within 30 days, I was growing and eating in 1 cubic foot thousands of calories of sprouts every day in 6 jars. And miraculously, 30 days later, I was eating just sprouts. Now I eat sprouts and fruit and seaweed and other things. But at the time, I was eating just sprouts. And I was concerned, maybe I was going off the rails. Maybe there was something wrong with this. So I started to do deep research, and I reached out to Dr. Joel Fuhrman and Dr. Dean Ornish and Dr. Joel Kahn and a bunch of other professionals. And turned out that all of these people that I had so much love and so much respect for also loved sprouts. And so that inspired me to write the Sprout book. So I wrote the Sprout book. And then, at 52 years old, I opened up a TikTok account and an Instagram account. And my book launched during COVID, where my book tour was canceled. And so I started to use social media, and since then I've posted, 1,000 times, and I've been on a dozen podcasts about sprouting. And I really see the opportunity for sprouts to go mainstream. And that's been my mission and my focus, along with the singer-songwriter, mountain climber, Mike Posner. We started the Sprouting Company to get the message out there. But as I wrote in the Sprout book, you can sprout in anything. I designed some tools to make it easier, and I curated some seeds. But my mission really is about getting people healthy and having them eating more fresh, ripe, raw plants and organic vegetables, and getting off the trappings of salt, oil, sugar, processed food, ultra processed food, meat, dairy, and animal products.
Thank you. Dr. Fuhrman?
Well, the last few years I've been living in a bunker in the Mojave Desert, when just living on lizards and cactus roots, seeing if I could survive. Sorry, I couldn't help myself.
The best. Okay. So
anyway,
on a real note, Joel, what have you been doing?
Well, I've worked pretty hard writing books and doing these television shows for years, and seeing patients full time. The last 5 years, I've cut back, and I've opened a retreat in San Diego because I felt that so much of my heart over the years have seen people who have known about this work and could have saved their lives. And for some reason, they didn't have the skills or the tools to do it on their own. So I felt like I could still keep my connection. I didn't want to just speak and write anymore. I like to see people and get to know them and work with them. So I didn't want to give that up. So my retreat in San Diego, I let people come here and they stay for a month or 2 or 3 to continue my love of watching people make radical recoveries, remove their lupus, their headaches, their heart disease, their psoriasis, and the food. So you know what it is? So many people learn about this information, but they don't apply it to their lives. And there's something stopping them from applying it to their life and so much social, you could say, negativity that precludes them from, and kind of confusion that precludes them from being successful, living so healthfully. So I built a retreat in San Diego so I could still get the personal satisfaction of working with people, but really make sure I impact people and they leave with the tools they need to do this on their own. So I've been doing that over the last 5 years and really loving it. And my wife and I are very involved with the guests we have here. We make new friends for life. We play games with them, and we might play pickleball or go for hikes. And so I'm not working quite as much as I used to, but I'm still doing meaningful work that's particularly rewarding to me, that I really love doing. So I've moved from the East Coast to the West Coast, and I also been growing much more of my own food, and of course, looking to, I do get sprouts, and I do utilize sprouts and always have, but I'm trying to get but now that I have your new sprout machine, I'm definitely going to start using it now and getting multiple machines. I've just been so busy and didn't have the full staff to devote to it, but it's really, I'm excited about adding that to our offerings as well,
Great, thank you.
Music to my ears, Dr. Fuhrman. Music to my ears.
So, Dr. Fuhrman, you've been doing this for a long time. You've written lots of books. You've given great advice. So the question is, at this point, based on your career experience and follow-ups with real people, what outcomes have you observed? What strategies have proven effective or ineffective in disease prevention? What are the most impactful steps one can take to avoid to avoid illness? How many individuals have you worked with? How confident are you in your findings? How often does this not work? In other words, we assume someone's doing what you say. What should they expect, and how often does it actually work and not work?
You sure you don't have any other questions to ask me in there?
I do, but I like that one.
That was like 20 questions in one. Okay. Well, first of all, most people in America are very sick, and about 90% are overweight, and about 70% are obese or severely overweight. And and their health deteriorates so tragically and rapidly as that once they pass the age of 60, that it really has been sad to see so many people with tragic lives as they age in this unprecedented opportunity where where nutritional science has made such radical advances, where we have the knowledge and the tools to enable people to live to be 95 to 105 years old. I mean, my opinions are radical. What makes my opinions radical is I'm saying that, you ask a lot of people, a lot of doctors in the plant-based movement, cardiologists, and they'll say, yeah, we could prevent 60, 70% of most heart disease, and we could help a lot of people. But my 40 years in this movement and taking care of so many patients, and I'm saying, well, using more than 20,000 people I've cared for over the years. So I've really been in the trenches using nutritional excellence to reverse disease. And I've had so many hundreds, if not thousands of people with advanced heart disease, diabetes, and all types of diseases reverse, that it's my impression that it's not like 60 or 70%, it's like 95%. It's like we really can reverse and protect people from heart disease in like 95% of the cases. It's very rare that we can't. In some, there's some things you can't help. They're so advanced, or maybe there's some genetic component or valvular component. There's always something that's not going to work. But my results I have to say, have been more radical than what most people are reporting. And I think it's because of my no compromising attitude and my working closely with the individuals who are sick. And I've seen that not just with reversing heart disease, but also with recovery from autoimmune conditions, such as lupus, rheumatoid arthritis, ulcerative colitis, psoriatic arthritis, mixed connective tissue disease, and multiple sclerosis. I'd have to say that over the years, a lot of my practice has been involved with people with serious autoimmune disease, and me working with them to not just give them a dietary assignment or a diet style, but to tweak the diet and to adjust what they're doing, supplements, diet, food, elimination diets, fasting, and just working with them to help them on a one-to-one basis, customizing it to their needs to make sure, to assure or to increase the probability of the making of complete recovery. And, a lot of people, for example, with rheumatoid arthritis, and by the way, I left out multiple sclerosis. Many, many, many people with multiple sclerosis in my book, Eat for Life, I think I must have included at least 5 cases of MS that reversed themselves, and a very, very high success rate with MS, unless it's there's a certain type of MS that gets very advanced, and it gets so advanced where the people get wheelchair confined. It's not relapsing and remitting; it's degenerative MS, and if that advances, it doesn't seem to be reversible. But still, the majority, that's more rare. So I'm saying in most cases, people can make complete recoveries through nutrition. And the point here is that the tools available to the conventional physician, where they're just utilizing drugs that are toxic and cause cancer, are so limited. A person goes to a rheumatologist for an autoimmune disease, or a cardiologist for heart disease, or an endocrinologist for diabetes, is not getting proper care. They're getting second-grade care because the person doesn't have any tools that can enable this person to make recovery, and their only toolbox are drugs that just are like sweeping the dust under the rug. They're just like controlling symptoms while the person's health and their condition deteriorates and their lifespan gets shortened by the medical treatment rather than lengthened. So I have to say that I'm very much passionate about what I do, because what I've seen and the cases that you asked me, these cases, and I could give you an example of a teenager who was on the National Renal Transplant list waiting for a new kidney with a creatinine of 4.2, which means 90% of her kidneys destroyed. And when she came to me, she made a complete recovery, to my astonishment, and her creatinine went down to 0.8. So watching lupus patients get well, and watching people with type of renal nephropathy go away, with autoimmune hepatitis get better. All these unusual and rare diseases makes the diagnosis less important, and the intervention, the nutritional intervention, more important. So the answer to your question is yes. I'm very blessed to have so many people put their faith in my care over the years, and be able to work closely with them, and to enable so many people to make recoveries. And I think that's the most exciting part of my career. It's not being on television. It's not getting best-selling books. It's not getting accolades. It's really working with people and being in that room with them, to enable them to get better and feel the joy of them making a recovery and getting back to having a normal life again. That's really my most joyous part of my career has come from. And I know you asked some other part of the question that I didn't answer.
That's good.